We are recording.
Thank you. So good morning, everyone, and welcome to the revised MnCHOICES application launch webinar for Wednesday, January 11th. Today, we're going to talk about transition instructions for agencies who are working in the current systems. So working in the MnCHOICES assessment or MnCHOICES support plan applications, creating assessments and their associated documents, CSPs and CSSPs. So let's go ahead and get started today. So on the screen in front of you is the list of people who are potentially with me today as policy. I am blessed to have them here with me to be able to answer questions. This webinar may feel a little bit different. I anticipate that there'll be more conversation with policy coming in on slides and providing clarifications. So if that's not something that you're used to, please know I've invited that to occur so that we can make sure we give the depth that you need to each of the slides. And so thank you, policy, for being willing to do that and being such a great partner in these launch webinars. So let's go ahead and get started. Let's talk a little bit about the objectives. You guys see this every launch webinar. You're probably like, oh, Teresa, do we have to go through them all? But really the goal here is to make sure that you understand and can communicate release schedules and any content that we talk about, that you learn about the tools in the computer application to help you complete your work and your users complete their work, especially in workflow and handoffs, which we've done some of already, and that you really get a depth of knowledge, an increased depth of knowledge on how to use the application, how it functions, and its workflow plan as we move to launch. Today, we're going to really talk through about implementing the transition timeline and the use of historical documents to really get to that objective. That's kind of our main focus today. And then we'll later, of course, talk about how to update staff data so that you'll be ready to implement new users at launch. So I'm hearing my audio is low. Is that helping it any, Monk? And is that improving it any?
I can hear you loud and clear. If anyone's having an issue, please either log out and join and come back in, or check your audio settings.
Okay, thank you, Monk. I just wanted to make sure it wasn't on my side. So, okay, I'm going to keep going then. So as you heard me say at the beginning of this session is being recorded. We're letting you know so that you're aware of the recording. We are using web audio, and so we are recording it. And then for today, we've got you all on mute. When it's time for you to ask questions, we'll ask you to raise your hand, and then we will call on you. We'll try to call on you in the order that your hands were raised. And then when we call on you, please know that means we've unmuted you. So don't be afraid, don't hesitate, just go ahead and try talking. If we don't hear you right away, we'll be like, are you on mute? Or are you talking? And so just know that as soon as we call on you, we're unmuting you. Or there might just be a second delay, but not long. So, and please introduce yourself when you unmute. So let's talk about today's agenda. So part of what we're going to do is there was a few things from the last Q&A from the last webinar that I would like to review again, and there was one item that I left you kind of confused on that I want to go back and talk about. We're also going to talk about today's terms and key dates and useful details. Then we're going to spend a little bit of time talking about person data in the MnCHOICES database. Then we'll review the transition instructions that we will be providing you. And then we'll talk a little bit about MnCHOICES and CFSS so you have a better sense of it. And then lastly, we'll talk about historical data. I'm realizing that this agenda, we may have moved the slides around just a bit so that slides may not be in the order of the agenda, but this is what we plan on talking about today nonetheless. So let's start with items from previous webinar, and I've tried to make them so they don't feel so disconnected. So one of the places where I was talking about apples and oranges, and you guys pointed it out for me, which I really appreciate, I then have now tried to clarify on this slide. So part of what we were talking about at the last webinar is we're going to have you continuing using the forms that you were using for reassessments and transfers. And then that got mixed in with the MICP. So I want to clarify it. To date, MICP has been used for communications between agencies for reassessment. That will be our plan to continue that way going forward. So people will continue to use the DHS 6791E. We're going to have MCOs be added to the MICP list for the purpose that shows here, so the care coordinators can communicate to assessors, and that MSHO and MSC Plus care coordinators can communicate to county and tribal nations to complete assessments. So we will be moving forward with that, and that is why. And then secondly, transfers of a case, you'll continue to use the DHS 6037, and you'll use that process that you currently have in place for making those transfers. There are some edits that are being made to the form to more clearly reflect the revised MnCHOICES application, and policy is working through them currently. So we are lining ourselves up for getting ready to launch. So one of the things that I did, and you're seeing it in an email not that long ago, we went through and we scrubbed some training, and we scrubbed training and added items to it. So I'm going to talk through a couple of places. I'm going to talk to you about kind of some pieces that we've added, and this is one thing that I have added into the access and navigation training, is to help people understand what is sitting in the help center resources. And so what will be in that help center resources, or already currently exists, is the current functionality and future enhancements document, and there'll be an update to that coming soon. And that outlines kind of what items aren't functioning as expected and instructions to work around them. Then we have the practice guides, and they're for each form. They basically give you all the guidance you need for a form if you're not sure what to do with a box, you're not sure, you know, kind of any kind of guidance piece. Those practice guides, whether it's a practice guide for an assessment, practice guide for a support plan, practice guide for an HRA, just as examples, provide that level of detail. If you're looking for a step-by-step walkthrough of a form because you've got your training in mind, but you're stuck on something and you want to go figure it out, go to the smart guides. There are smart guides for all kinds of items in the Help Center. They're a great tool. And so again, we have added this list in training, so when your users are taking training, they know about each of these resources. I've had a lot of questions about microlearnings, and we'll talk about them in a few minutes, but they're really just short user tutorials. They run about 2 to 4 minutes. They're just for that kind of, I can't remember how to do this. I can go see if there's a microlearning on it, and I can play it quick and then go back and do my work. We also have a group of items that sit in templates, and we'll talk a little bit about them today. There are two kinds of templates in there currently. One, there's templates, instructions, and an attachment when you provide a historical PDF to a person, if you need to do that, specifically because the appeals and other things aren't in those historical PDFs, and so we want to make sure you have what you need to send that back out. And then secondly, we have a similar attachment for a support plan when you print it out, so it gives the person all the notifications required. There's also a MnCHOICES user manual in the Help Center, and it literally walks through every single field in MnCHOICES, or the functionality, I guess, the big picture functionality in every single piece. So if you want to get yourself acquainted with it, I think it's a great document. It has lots of pictures. So when you're not sure about wording or you're not sure about where something sits, you can go back and look at it, look at the picture and go, oh, I understand. And I just want you to know that we've made sure that this list and its explanation is in the access and navigation module navigation header. Okay. And the reason why we did that was just to make sure that, again, your users are aware of it. I saw the question come through about, can they be downloaded? The answer is yes, they both have view and download as an option. And if you remember from our last conversation, when you download, we anticipate that when you're done using it, you will delete it and download the next time to make sure you always have the most updated and you're not saving and using an outdated document. So I just want to provide that caution. Not that you can't download, just that you need to make sure you have the most recent. So this is what so when you go to the resource center, this is what the template one looks like. I just wanted to give you a sense of it, what you'll see. And then it provides a description. I love this about this help center. It's probably one of my favorite things about this application is that not only do you have what each of the resources are, but you have a description about them. So if you're like, well, should I be looking at this? What is it about? I think that this does a great job. It's a really nice feature in this application. So I want to briefly talk about microlearnings because I've had questions about them and I want to be able to have the chance to explain to you kind of like when they would get used, why they would get used, if they're a requirement of training is kind of the questions that I hear being asked. So you can easily enough pull a complete list of the microlearnings by going into the help center, and I'm bringing up the application at the same time. So if I feel like I'm kind of pausing and stopping, it's because I'm going to try to show it to you visually as well. So basically, if you want a complete list of the microlearnings, you could search in the Help Center for microlearnings and copy it and put it somewhere for yourself so you would have it. I'm not sure why you would need to do that if you can provide this, if you can have people learn how to use the search to see the complete list for themselves. But the purpose of the micro learnings is really, like I said, it's just an on-demand tutorial for basic things. How to do assignment, how to search for a person, kind of those things that people may not remember. They are not connected to training, though in the navigation header module, we talk about the micro learnings. We added that piece in and asked them to go out and look at one. I think I have them doing search for a person so they get used to them being in existence. But I'm going to just show you this so you get a sense of what I'm talking about. So I'm in the help center. Up here, I'm in the search. You can see it, right? I'm going to put in micro. If I can spell. Here's a list of all the micro learnings. I could, if I wanted to, just copy this and paste it. I'm not sure how useful it would be, but you can see then the whole list of micro learnings just by changing the search feature and learn what each of them are about. They really are here just as shortcuts when you need to remember how to do something or aren't sure about how to do something. And so they really aren't a requirement of training, but they are, I think, an amazing feature that people will use. So a couple of items that I want to make sure that I share with you. We heard from the last mentor training pretty loud and clear that it made sense to split up this transition conversation to reduce confusion between the types of work that you all do. And so we literally separated today's conversation from the MCO and MCO delegate conversation about transition instructions. So I'm not going to go over instructions that are specific to MCOs, or if you're a county working as a delegate, going over those instructions for MCO, you'll need to do that on the 8th. This will be specifically for counties who are working in the current two systems and creating assessments, CSPs, CSSPs, LTSS evaluations. And we're doing that separately so that the MCOs will have the chance to have a conversation and get their head around what they're launching into better kind of by themselves, knowing they're going from paper to the system. The other piece to know is on March the 8th, which is the next launch webinar after that, is we are really going to talk about what to expect on April the 3rd, and we're going to spend some time talking with security liaisons and any other staff that you will have that will be working as, have that lead agency admin role, or sorry, security role, should say security. So that you really understand what you're doing and how you add users and how you maintain and make changes to users. So that's very clear as you get ready to launch. And then if there is any procedure about adding staff, agency staff, not in your onboarding sheet, we'll have the plan for what that looks like. We'll talk about it in detail then, whatever that is, whether it's you adding them individually and putting in a ticket or some other change. So I just want you to be aware of that. And again, we'll talk about managing user access in case you have people you need to remove, or there have been changes to people's names or other things that you want to make sure that you can address as it regards to your staff. So that is coming in March. I'm taking that into consideration. Then for April through July is really post-launch support. So these webinars are going to be more about what items do you need to know? What questions do you have as you start using the application? And so at this point, they don't have topics. We normally have them monthly, and I'm looking at coverage to make sure you have support during that whole period. And we're going to be looking at, do we need to do 2 weeks? And if so, every 2 weeks have some kind of webinar? Does office hours and the webinars cover it? So I'm going to kind of do a clean sweep of that and make sure we're going to go through that today with policy to make sure we have a clear support for you throughout the transition period, so that you can get the support that you need. So one of the questions that gets asked, and I totally get this, this is a new way of thinking. This application is organized around the person and then what gets attached to the person. And so forms in MnCHOICES are literally all of those documents that you work on with and for a person. So they're assessments, evaluations and screening, LTSS improvements, and support plans. And I was just going to show you that purely from just to make sure that we all are on the same page on it, always from the beginning. And so if I'm in a person record and I go to forms and I want to create a form, it's literally all of these things and then all of the forms that are associated with them. So if it's right, so if it's an assessment, there are 2 different kinds of assessment forms. If it's an evaluation, there are, or screening documents, there are screening documents associated, but they're all forms. So anything that shows up in this form category drop-down menu or the form drop-down menu are all considered forms in the system. And when we talk about a form, that's what we're talking about. Again, only to provide clarification for you so this is less confusing. So today you're going to hear me use these kinds of terms, and I want to just lay them out to make sure I don't create confusion at the beginning by the way I use language. So when we say agencies, we really are referring to kind of everyone: counties, tribal nations, managed care, contract case management agencies, and delegates. And we use agency when that application functionality works the same for everybody. When it doesn't work the same for everyone, then we specifically call the agency, the kind of agency out. So if I use agencies overall, it applies to everyone. When I talk about legacy documents, I'm talking about eDocs used by agencies to complete assessments, CSPs, CSSPs, and MCO care plans. So they're basically what I think about as paper documents, but none of us probably use paper anymore. So it is really the eDocs that are associated with them. So legacy is about eDocs. The MnCHOICES assessment computer application, I call MNA. We use that, that's how we refer to it. The current MnCHOICES support plan application is MNSP. And again, it's how we talk about that application. If I were to talk about both of these applications together, I would say the current applications. I would not call them the legacy applications. So if I talk about MnCHOICES assessment and support plan together, I will say the current applications so that you're aware of it. The revised MnCHOICES application is this application that you're getting ready to launch into. It's a future launch. It's an application that was built in partnership with FEI Systems, the vendor, and DHS. And another place where sometimes I want to make sure that we're clear about is when we talk about services. When we talk about building services or planning for services in the application, we are considering both DWRS and EWRS rate tools. Sometimes you'll see me specifically call out EWRS rate tools because there have been rate plans being built in the support plan as part of the transition So elderly waiver rate tools were used for MCOs when they launched into the support plan, but counties are using the CSSP and creating their service agreements that way, but they still may be doing EWRS in them. And so I'm kind of stuck having to, to explain this, that when I say services, I mean everybody. And because I don't want to leave DWRS out, because it tends to be I focus on how does something currently function, and I don't think about DWRS just automatically. So I want to make sure that I'm clear when I talk about services, it's all the services. So one of the things I want you to be aware of when we kind of talk through what's possible and not, why we've made the decisions about transition instructions and other, is we have some pieces about the system that we're living with. So, and that you're living with. So as of January 31st, this FEI's revised MnCHOICES application goes into code freeze, and it stays in code freeze from January 31st to March the 30th. And the reason for that is FEI Systems is preparing for the launch. They're getting the production application all the way up and ready to go. They're loading all the data, they're testing it all, they're making sure it works well, and they need time to do that so that we all have a successful launch. FEI Systems is the vendor who has built the application. We've talked about them on a number of occasions. They are the vendor for the MnCHOICES revised application. Okay. They're the folks who have helped us build the system. The launch date, the date that the system production is up and going. Oh, I don't know what it stands for. It's a good question. You could go Google it and see. Um, the launch date is set for March 30th, so that's when the system's going to be stood up and live. You will start using it April the 3rd. So that you're aware. So I have to make sure when I say launch date, I don't talk about it as April the 3rd. The launch date is the end of March. The day that you start using it is April the 3rd. It's a very good reminder for me as well. And so you're aware of that. So when we talk about this transition period, I want to talk a little bit about why we've chosen the date range that we have. So when we talk about a transition period, we're talking April 3rd through June the 30th, okay? That is the period in which you start using the system and when the support plan and the MnCHOICES assessment applications are deactivated, basically retired, okay? The reason for this is, if you think about it, the legislative changes come and the rates changes get applied to the systems, get applied to the support plan in this case. And the next time that would happen is July 1. And so what we're doing is there are resources allocated to update the revised MnCHOICES application, but there are not resources set aside to update the MnCHOICES support plan application or to keep these two systems up. So we are accommodating the rate changes and putting them in the revised MnCHOICES application and then retiring the systems as part of that. And so we just want you to be aware of why the state range is chosen, and that's part of the reason how it came to be, as well as your request for a longer transition period. So one of the things I want to make sure I spend some time on today is we have been hearing your questions about intake. And kind of our aha light bulbs went on, and we said, you know what, we think part of this question is really about what person data sits in the database and will be available to you at launch, and that it would be useful for you to understand what data you're going to see that you may have in your intake systems. And so I'm going to talk through those because I think that will be useful to you. This first slide is really about person data being migrated into the revised MnCHOICES application. So you're seeing PMI and Social Security and date of birth in here because those are kind of the key decision makers on what person data comes over. They have to have a PMI or a Social Security number. They can have a date of death that is blank or less than 6 months to have that data be included in the database, and then person data that has been updated in the last 2 years, when an assessment has been modified in the last 2 years, or the support plan has been modified in the last 2 years, that data is also coming over. I know you're going to ask me what date that is. It's based on the date that it migrates, and I have to find out more about that date. I did not see it in the information that was provided for us. I think it's just more important for you to understand if data has been updated, then that data comes over. So what kind of data are we talking about? So there's basic demographic information, and part of what I did is I went back and looked at the MnCHOICES assessment intake data to get a sense of kind of what the headings were called, so you could get a sense of what was coming over. So name, first, middle, last, and suffix, birth date, gender, marital status, person numbers, so it'll have their PMI, their Swindex, and their social security number, and then address. I'm not going to read through all of these because you can see them, but it gives you a sense of the kind of data and specifically home, mailing, and physical address. And then regarding phone, it'll do the same thing, phone extension, any comments, and then for each of the types of phone, and the same will be true for email address, comments, and the last change date. And then the other documentation that comes over that kind of sits in that lead agency and communication information is, are you Spanish, Hispanic, Latino descent? What's your race? What is your primary language? Is an interpreter needed? So here's some information that isn't going to be migrated over, so that you're aware of them. I won't read through the whole list, but it's more important that you know that the MnCHOICES application will be available for 90 days. So if for some reason you need to pull this data over for a person, you'll have the ability to go into the application, grab this information, put it into the revised MnCHOICES application. So this is an easy way for you to kind of know what isn't coming over if you indeed want to capture it and move it to the new application. So I'm going to stop there just to make sure we kind of get these basics in place and understood, and we answer questions that there may be around them before we kind of take the next steps. So I will ask Beth, are there questions that you feel that we need to answer in the chat so that we can move on? And if you have questions and you want to raise your hand, please take the opportunity to do so.
First question is from Jessica Mickelson. Jessica, you are unmuted.
We can hear you. It was just very, very faint. Go ahead.
Very faint. Sorry, I'll try to speak loudly. I guess my question would be regarding people who have not had a MnCHOICES but are in SSIS. Will any of their information populate into MnCHOICES revision when we're searching for them?
Sorry, I'm thinking about it. Amy, I'm gonna have a conversation with you for a second. We know the data comes over from Swindex. We know the data is a MnCHOICES application. I also know some of the data is populated that is also held at SSIS, but do you know if we know that answer to that question specifically?
Hi, Teresa. Hi, everyone. This is Amy Alexander. Yeah, so there are two, from my understanding, there are two places where the data is going to be coming over. One is from Swindex, and that's a nightly load of any social security number, PMI, date of birth, and then name and date of death, if that's applicable. And the other source is from the MNA application. So it's the data that Teresa just showed, information that would have been entered in MNA, and it had to have been either updated in the last 2 years, so some of that data updated, or they have an assessment or support plan created or modified anytime in the last 2 years. So it won't be any data straight from SSIS. So Swindex or MnCHOICES or MNA are the sources of the data.
I am ready for our next
Okay.
question.
Yeah. Okay. Well, Jessica, you still have your hand up that you muted, so I'm assuming you're okay. Okay. Thank you. And then, so we have a question from Katie that when you say new users, is that only for the revised MnCHOICES or for the existing MnCHOICES as well? And I think she was referring back to when you were talking about
User
onboarding.
access.
Go ahead.
Yeah. So no, so if you have people you need to add to the MnCHOICES assessment application or support plan application, do that. They need to do their work. They need to get their stuff done. What I'm talking about is we need to talk through how to, we know that we collected your user data in October, and we know that you'll have new users coming in April that you'll need to add to the revised MnCHOICES application. We just can't load them during the code freeze. And we have to determine for you what that's going to look like for you for a process to add them on April the 3rd or any time after that. And so we're having some conversations internally about that. And we will have something for you for the March webinar. So that's all. So no, please get your people in the systems that you're those current systems we're using. They should have access. They should be able to do their work. You shouldn't have to wait for them to do their work. We just have to determine how you're going to add your new staff into the new system since you've already loaded your folks.
So we have a question, actually there are two questions kind of together. One is about what staff warning is referring to, and then the other is just asking why it's not being pulled over, and then conveying that it's important information for assessors.
I'm sorry, so say it again, say the first piece again.
So staff warning, so she was asking what a staff warning would be referring to, and that would be something that we include in our intake, that you're documenting if
there's a
owner,
dog,
or if the person you're going to go see, if there's a dog, if they want you to use the side entrance versus the front door, I mean, just all of anything like that. And so it might be important to make those notes and pull it over into the system. You can add that into the person profile. And so if you know that there's some important information there, to grab that and pull it over. We weren't able to do it just because, again, we're not dealing with apples to apples in all situations. Sometimes it's apples and oranges of how it works out and where it goes in the system. And so we pulled over what we could.
Yeah, and I think the other piece to be clear of, not all of the counties and tribal nations are using MnCHOICES intake at all. So this is only true of the fact if you're using intake to have these fields, then these fields won't come over. If you're not using the intake functionality in the MnCHOICES application, this piece doesn't affect you at all. So just to be clear about that as well. So if you're getting confused by this and you don't use it, that's why it's confusing. So then it's like, never mind. It doesn't apply to you.
Okay, Teresa, we have Leah from Candy, Ohio. I'm Leah. I'm going to unmute you. Your hand up.
Good morning, Leah.
Hi, Leah.
Assessment PDF, is that going to be the assessment report that's in the MNA, or is that something completely being created separately that's not already existing?
I will talk about it coming up when we talk about historical data. So if you don't mind waiting, it'll basically be. Yeah.
It ties into the warning, because if it is similar, then that warning would be in that report, so anybody would have it.
Correct. So even after the application is retired, after the MnCHOICES assessment application is retired, the historical data PDF should still retain it. Correct. Thank you for pointing that out.
Thank you.
Yep.
Okay, our next question is from Madonna Klinger. Hi, Madonna.
Mayor with Anoka County. Question regarding assessments, initial assessments that are completed in the current system, and then needing an eligibility update when the new system launches, the revised application launches. Is the assessor able to do an eligibility update in the current system, or do they have to do that eligibility update in the new system?
I'm sorry, I feel like I interrupted you and I didn't mean to. So that you know, though it's not on my agenda, we will talk about eligibility updates in a little more detail later. So
Okay.
just know that we will talk about it.
Okay.
But thanks for asking it.
Okay. Thanks.
Yep.
Okay, Angela Basto, you're unmuted.
I don't know if you addressed this prior, I came a little late, but I know initially with the intake, we could only put a person into the new system if they had a PMI or a social security number. A concern I had the first time we were supposed to launch was, you know, those last minute assessments that we get every now and then from assisted livings that they've transitioned somebody from a hospital, and we don't have that information in order to even put the person in the system. Do you have a workaround for that, or has anybody discussed that problem?
So what we have been talking about is this, that if a person doesn't have a PMI or social security number that you're aware of, that you would request the PMI, and then from that system take the PMI and then add the person to the application, entering the PMI number that you were given, is what we are thinking is the workaround.
I'm unclear. So if they don't have a PMI, where would the PMI be coming from?
The only piece I can speak to in policy, if you can speak to this in more detail than I can, is what I have been told is you can go to the system that creates PMIs and request one for the person. It will give you a PMI and then you can enter it into the system. And I can't remember if that's
working with your county financial.
There is a way to do that, but there is times that we get an intake at the end of the day, and I'm going out there at 4 o'clock in the afternoon to do an assessment.
I'm hearing you.
So, I mean, and at this point, you haven't given us a way to backdate it. You know, if we have to go out and do it on paper, or, I mean, at this point, it doesn't happen often, but it does happen.
Yep. So I will take your question back versus trying to problem solve it here live, right? And
Okay.
I will make sure that we talk that one through, where you've got one of these you've got a nursing home and you need to do assessment because they're going to be moving to something else, and you've got this time period where it's in between. So I will go back and ask the question. We will come back with a solution for that.
Okay. Thank you.
Okay. Yep.
Okay, that's all of our questions on the line. We have a few in writing. Teresa, can you just review again, will old assessments be loaded into the new application?
Yep, and we'll talk about that in historical data. Basically, the answer is yes. So what I would like to do is go ahead and ask the other questions that you have, and then I would like to continue and not take any more questions because I want to make sure we get to everything.
Okay, so we had talked about that only closed plans will get pulled over. The PDF will get pulled over into the new system, and they just want to confirm that that's still correct. The
That's
plan
still
is to be closed?
Yep, yep, and you'll see it when I talk about the historical data.
There's a question about onboarding, because we did onboarding in October. They have several new people, and they're wondering if we would consider taking a list of current users support plan users for the revised application.
Yeah, so the answer to that is in March, I will have the solution for you. That's literally all I can say now. I hear you loud and clear. You'd like to hand us a list and have us do it. We are looking at the functionality of the system and how it needs to be done, and so we will provide you a solution as part of the March webinar. So I'm going to go ahead and keep going, Beth. Is that okay?
Yes, that's fine.
Okay. I just want to make sure we get to all content. We don't leave something so we don't talk about it. So this is a screenshot of the transition instructions that I am going to talk to you about today. The heading may look a little bit different once it comes out because I've seen it got an edit after I took the screenshot, but we will post on County Link the transition instructions that I'm going to talk through. It will include the MCO transition instructions, which I am not going through today. But I just wanted you aware that they are being posted. They're going through final review. I'm hoping that they'll be posted by Friday, that the last approver will complete their work and they will be ready to be posted. They will be posted. I will show you where. So on the I'm on County Link. I'm going to the MnCHOICES revision project page. And see right here where it says transition instructions. Whoops, sorry. That's where those instructions will live. There will be a live link here. Like I said, it should be ready by Friday. We've been working really hard to get it done and all the content ready for this webinar. And so this is where you will see that link when you want to refer back to the document itself. So let's talk through these transition instructions. So first, let's talk through the 90-day transition period, that April 3 till June 30. So by July 1st, 2023, you agencies will complete any documents started, including any legacy documents or assessments in the MnCHOICES assessment application, and all the documents for support plan, CSP, CSSP, and in the CSSP service and rate details, and then rate plans, specifically because elderly waiver has its own rate plans. So all those will need to be completed by that date. After June 30th, to make updates to documents not created, so if you didn't create the document in the revised MnCHOICES application, but you need to make an update, we're going to talk through how do you make those updates, okay? And again, policy at any point, if you feel like you want to add depth to this conversation, you are welcome to join me in the conversation. So for legacy documents, for those eDocs, the long-term care consultation, developmental disabilities, and personal care assistant assessments, those all will need to be completed in the revised MnCHOICES application. And we are updating the efficiency memo, the MnCHOICES efficiency memo, and we will be adding that update to the communications page. It is set to be coming soon, and we will send you out a communication that says the update has occurred. So for the MnCHOICES support plan application, before July 1st, a county and a tribal nation and contracted case management will need to complete a CSSP in the MnCHOICES when assessment was already in the MnCHOICES assessment. So if a MnCHOICES assessment has been started, you'll need to complete it before July 31st. That's what this is saying in the MnCHOICES support plan. So you're going to have that kind of timeline. So updates to documents not created in the revised MnCHOICES application. So after July 1st, because the current applications, the assessment and support plan will be retired, you'll need to create a support plan in the revised MnCHOICES application and use, there's a reason called transition plan, and I will show it to you in a minute. And so if you want to make a change to a support plan, you'll need to choose a support plan with the reason transition plan to make changes. And so specifically, here are the scenarios when you will use that transition plan. when there's an assessment in the MnCHOICES application and the user needs to create a support plan in the new system, when a support plan is retired, or when the application is retired and a CSSP or a service needs to be edited. So you can't edit it because the new system's been retired, but you need to make an edit. So you'll need to use that transition reason. So what they're trying to do is think through all of the times. So if an assessment was done, but the support plan's retired and you need to create a new support plan, then you would do it for a transition plan. If the support plan application is retired and you need to make a change to the CSSP or its services, then you'd need to be able to use a transition plan to make that change. And again, if the application is retired and you have a rate plan that has an EWRS rate tool in it, then you would need to use this again, right? Because you need a way to be able to change it or update it. So the goal was to accommodate your need to make changes to plans. So when you create a new support plan form, you will then pick new form support plan and then the reason for support plan. And hey folks, before reacting to do you have to do everything, just take a breath and listen a minute, because I want you to be able to hear kind of where we're going. So we've built this as a temporary process. We've done it, and we provide practice guide instructions on what you do have to complete for fields when you make updates. And so I want you to take a chance to read that and learn about that, so that you understand it. You know what, before I go any further, sorry, I just want to make sure I look at what my slide says next. Okay. And then also then we talk about this, we added the transition plan into the training module for the support plan module 7 to make sure your staff had the information and you weren't having to carry it back to them as mentors and explain to them the how and why. And we've included the practice guide in that information so that they're aware of it. So I just want you to know that we've done that as well. So let's talk about when to use it. So you need to make a change to a CSSP that only exists in the old system and there's not an assessment. That's in this scenario, that's what we're talking about, okay? So it permits the user to create and complete a support plan without an assessment. This is, of course, then for temporary use because at some point you'll have an assessment in the new system and then you'll create a new support plan from that assessment. So this is just the temporary during the time period where you need to be able to do this. And just know that you'll need to consider when you do this transition reason, does the plan need to be signed? You will know, kind of like here are the changes that I've made. Yes, it requires a signature, and then you will need to take that into consideration when you create a support plan with a transition reason. And then if you are making a change to an EWRS rate tool, there is this customized living in foster care worksheet available to assist you with that. And there is more information again on it in training, but if you want to look at it, if you're doing rate tools, be clear. This is if you've done an EWRS rate plan and you need to make an update, that you would use this, and it explains to you how to do it. And so basically what this form will do is you can see from the purpose here, the purpose says this form provides information users need to plan for foster care and customized living. It determines a monthly cap. So you can just go there and read about it and how to use it. It determines if the person is eligible for 24-hour customized living, and always go to the practice guide support plan with transition reason. Policy has spent a lot of time creating these practice guides for you to help walk you through the decisions you need to make and when you need to make them for these transition reasons and what you have to put in for data and what you don't have to put in for data. So I would recommend that you go through and you read these before you kind of react to what does it mean I have to do, to really see what it says. So please do that. What I don't know is, folks, do we want to say anything more about, and you can say, no, it makes more sense to read the guide. Do we need to say anything more about the concern you're hearing in the chat about having to complete all of the fields all over again so that people can let that one go? Jessica, I was going to wait just so you know, if you raise your hand. I have how many slides? I have just a couple. Oh, actually, let's talk about LTSS and then I'll take questions and you can ask them all that you want, because after this slide is questions. Okay. I was just looking ahead on my thing. So the other piece to know is for the LTSS improvement tool, because again, we're talking about this 90-day transition. So let's just finish the 90-day transition. Okay. So you'll complete all your LTSS evaluations in the MnCHOICES support plan, and after that you'll wait for us to announce when the forms are ready to use in the new into the revised MnCHOICES application. So please know this is only during this 90-day transition time that we're talking about, but I am open to taking questions here. So yep, why don't we go ahead
Okay,
and
Teresa,
take them
with Jessica? Yep. Okay, Jessica, I'm unmuting you. Whoop, not very well. There we are.
All right. I was just wondering, is the transition plan appropriate to use for a Rule 185 recipient who has opted to waive their annual reassessment? Would the case manager then utilize this transition plan to create their support plan so it's updated annually like it's supposed to be? And if that is appropriate, how long will this transition plan be an option in revision? Because we have folks who waive their reassessments for multiple years in a row if they're, just receiving Rule 185 and they haven't had a lot of changes. But the case managers still update their CSSPs every year.
And that's awesome. And that's exactly what you'll do. You'll use the transition plan. When we're saying temporary only, it really is temporary only for people on a waiver. But if you have the option to waive and need a CSSP, the transition plan or something similar will be available to you.
Okay, perfect. Thank you.
Okay, any other questions on the line or anybody else calling in? Okay, I will keep watching that and then I will try to get through some of these other questions that we have. So we have Lisa wondering, did I miss the instructions on how to make the changes to content on a reassessment done in the current application after it's unavailable? Teresa, do you want? I can answer this question. Okay.
Yep.
You got it. Okay.
Yep.
Okay.
Go for
it. Okay. Well, so when it's done, it's done. I mean, when we have to have a time that we can't continue to work in MNA, so in our current system. And so if you have work that needs to change after that, I mean, your option is going to be to do, I mean, we're not able to go back to open anything up. We don't have that. We won't have access. We won't have access to that system. It's just, that's just how it's going to be. So we would really encourage you to make sure that all of the work is done prior if you're wrapping up an assessment, and that starting April 3rd, April 3rd is the date, sorry guys, that you are starting all your assessments in the new system as much as possible. That's just going to create, you can continue to work in the new system. You won't have to worry about that not being able to access to update an assessment. So Teresa, would you add anything to that?
No, I think the question though is, what happens if for some reason I just can't? What do I do when I need to revise? And do we have an answer for that?
As of right now, we don't.
And I'm writing it down.
We don't have the ability, but we'll bring it back.
Yep.
Okay, so we have a call, Kathy McMahon is calling in. Kathy, you're unmuted.
Say I'm following up on a concern that we discussed last week about assessments that have been assigned in the 1.0 during the month of February for April, or sorry, in the month of March for April assessments, and our concern about trying to move the 1,600 estimated annual assessment assignments into the tool on April 3rd and still have time for the assessors to complete them, and some of our staff who won't be onboarded into the tool yet, and that kind of thing. And I'm just wondering if you're ready to address that, or what your thoughts are about that.
So it's a complicated, layered conversation that we are working through. Where we currently stand is we're working through the policy for how to add your staff, knowing that you have a bunch of staff to add. Everyone has staff to add because of changes in hiring, especially since we know there are turnover in some positions more than others. And so we're going to try to work through that piece as much as possible. And we have some of the questions that need to be asked around that happening as we come up to the March webinar. In regard to what to do with people that are assigned for an assessment for those kind of first weeks in April, you're going to hear a little bit about that as we talk through eligibility update when that comes into effect. And I think the biggest piece is in policy, if I overstep myself and you feel like we need to talk about this differently, we can. But the overall choice that your agency is going to need to make is when to do assessments in the old system, and can you meet the, and will you get them done in the support plan in time for when the systems retire? And that's kind of your choice. What you've heard policy say is that they're telling you the soonest you can get in the system and do the assessments in the new system, the better it's going to be for you for timelines going into the future. And I think at this point, that's all anybody is ready to say yet, Kathy. Not that because of the conversations that we're having. And would you guys say anything differently, or would you add or modify anything I say policy, or do you have I covered it in the way that we've been speaking to it?
You have, Teresa. Thank you.
So that may not answer it all for you, but that's kind of what we've been talking about. So Beth, is there any other questions?
Yeah, I think we can move on. Kathy, your hand is still up though. I'm not sure if she had more that she wanted to say. So I think we can move on. A lot of the questions that we're going to see are covered as we're going forward in your PowerPoint. So I think we can continue moving forward. And folks, if we don't get to your questions, I'll make sure to come back to, if we haven't covered them, to make sure to ask them.
Yep, so let's talk a little bit about the historical data. And then I put the question about intake, specifically data that I want to go back to, Leah, because I answered it for you and then I thought, oh, I better make sure that the intake data is actually included in the historical data. So I may have to correct the record if I indeed spoke incorrectly. So let's walk through this, and then I have that note for myself. I wrote myself a note. So this first disclaimer is kind of for folks who are only doing legacy documents, and so they may have some concern about having or wanting to load or not wanting to load documents into the revised Choices application. So DHS has no requirement for lead agencies to scan or load documents into the revised MnCHOICES application, those ones that have kind of been past assessments, your DHS 6791 series, the 3428 series, or the collaborative care plans, which those last two speak specifically to MCO. So there's no expectation about loading those eDocs into the system for old or from assessments. So let's talk a little bit about the historical data, the data that's living in the MnCHOICES assessment application and the MnCHOICES support plan application, okay? So what you're going to find is that historical PDFs will include data from November 1st, 2019 through to the launch date. And then after that launch date, after April the 3rd, there will be that time period from April 3rd to June 30th while you will be doing your work and you'll be completing your work and you'll putting it in a status of closed or a disposition of closed. And then that data will then be pulled and put into historical PDFs as well, and it will be attached to the person. But that will occur after the systems have been retired. So you'll have first the data that's leading all the way up to the launch. And then after the launch, once all of that information is collected and closed, then another pull will occur so that it'll capture the historical data again. So I'm going to talk about what I mean by historical documents in just a minute. So let's talk about what that means. So you're going to be able to access PDFs and they're going to be attached to a person record in the attachment section. So I just want to make sure I'm clear about that and about where I'm talking about so we're all on the same page. Sorry, I have the timeout feature on the application, so I'm going to talk through these and then I'm going to go back and show you where, just to make sure we're speaking the same language. So information on the contacts will all from the person information in the support plan will all be in a PDF of its own. Assessment content when the assessment has been marked closed complete will be a historical document of its own and will be captured for each assessment. And then all CSP and CSSP content that has a closed status, that will be its own historical document. It will have captured the data and put it into the historical PDF. Service rate details are going to have their own PDF, and so they will be separate of the CSSP, but the information will be available. Rate plans, because we've got EWRS rate tools, again with the status of closed, those will be pulled and those will sit as their own PDFs with the data available in them. And the same will also be true for LTSS evaluations. If for some reason you need to go back and look at historical documents, you can. And so I'm going to show you where those will sit. So I'm in Alan's personal record, okay? And I'm going to go to the attachments section and they will be sitting in here, okay? For each person, each of their historical information for that list that I just told you will be sitting in these attachments so you can go use them anytime. So let's talk a little bit, whoops, sorry, you don't need to see that one. That won't be very useful to you. Sorry, I've got layers of stuff sitting here. So what you will see is, so you'll know what you're looking at. This is the naming convention that's going to be used. And so I just want you to have a chance to look at it. So it should be pretty clear. This is an assessment for this person, and this is the date that the assessment was completed, and here's the doc ID number. Similar naming convention then for CSP, similar naming convention for CSSP, and for rate plan and service detail. You're seeing this. So HICPIC modifier, first and last name, CSSP ID or rate plan ID, and the service end date, so you can easily identify which one you indeed want to look at. The goal here is to make sure that you have the data from the retired plans or retired documents in a person's record so that you can use them. So the other piece that we want you to know is one of the things that we were thinking about is what happens if you need to send out a historical document, right? Like for some reason you've been requested to send out an assessment that was complete and now the system is retired, or you have to send out a CSSP and it's been retired. And so we needed you to have a way to do that and then to also make sure you were in compliance with any requirements that are associated with that. So what we created in the help center in the templates are if you need to send historical data instructions, and then also with those instructions then are the PDFs that go with them. And specifically what this data is are the notifications that aren't a part of the PDF, so they don't have the appeals information, the ADA information, all of those things that are required to go to a person as part of, you know, just the requirements of doing your work for notifications, I guess I'll call them. And so they are all there. So if you're curious about that and you want to look at the instructions and you want to look at the docs, they're pretty clear here about when to attach them and why. And like I said, it's literally, I will show you one. It is literally the that appeals, the ADA, that type of information, because they won't be on that historical data. That data will just be a decent representation of the assessment, the CSP or the CSSP, and then you will have to add the document. So I'm just going to show you that what I am saying is actually so. So let's do, so for a MnCHOICES assessment here, we'll just view it. So again, you can see the language translation requirement and the ADA requirement is what you need for an assessment. For the support plan, whoops, helps if I do view. Again, interpreter appeal. So they're just here for you so that you make sure you have the compliance required if you go ahead and share that historical document with a person. And again, the instructions are here as well. So I don't know if people have questions about historical documents, and we should stop here and ask them. Where we're headed next, as you can see by this, is to talk through eligibility updates, Amy, so that you're aware also. So are there questions specific about historical documents we should take the time to answer before we move on?
Sorry, Teresa, I'm just reading through the latest.
No, I was just going to say,
I
was just going to say, I'm letting you read through it, so take a moment.
Well, there's a question for historical data. How can this be accessed for lead agency reviews? Because there are a number of items that for DHS requirements, or was assumed DHS MnCHOICES would be sure that they were available.
Yeah, so we're working through that with lead agency review. So that isn't anything that you guys need to worry about. The policy team here in lead agency review are have worked through the attachments, what's in, you know, like they're working through that piece and they have that solution. So if you're saying you need to know what the solution is to understand the details, I don't know anybody, folks, if you want to give any kind of reassurance about that.
Just, I'm not sure what we'd say at this point.
Right. Well, yeah, I was thinking Amy may have something that she wants to say or not say, so go for it.
Yeah, I could just mention, I mean, so lead agency review typically looks at, you know, the most current or the last year of documents, and so they'll have access to those PDFs that are going to be, you know, uploaded into the revised MnCHOICES as well. So they'll be able to see all of those old documents, just like you know, you all will be able to see them, and they'll have access during the 90-day transition to the old system if they need to. So they'll be able to view all the historical documents, you know, that are uploaded. And yeah, and then like Teresa said, that we're working with them on kind of this transition as well and how it might impact their review.
Are there any other questions?
We have a question about, so from the historical documents, can you copy and paste from the historical document?
The answer is yes, you can. The question will be, is it the most recent documentation, and do you want to make sure that you're not copying old information? Right? Am I answering that the way that you guys would?
You'll be able to copy the information, and you should have, I mean, you'll have the last documents, you know, the last 2 years worth of documents in the system, so it shouldn't be that's outdated, but, you know, we always want you to take a look at what you're copying in and making sure it's still current and, you know, taking a fresh look at it because you're doing a fresh assessment.
Yeah, it's just my disclaimer, right? No more, no less.
Yeah, yep. We still have a little bit of confusion about requiring phone numbers and
yeah, can we wait till we get there? Yeah, let's wait till we get there. Okay.
All right, guys, hang on, we'll get there. Okay, and then let me double check the phone really quick. Sorry, that went away really quick. Okay, we don't have anybody waiting with their hand up. So
okay. Yeah, it just
keep going.
Right, if we okay, thank you. And it's only because I want to make sure we get through the things that are, I call the things that we wonder about and don't have the answers to, and we kind of carry around with us our worry buckets. That's what I consider mine to be, my worry bucket. And so I want to make sure we get through those with you today. And I know that email and phone number is one of them, and I'll try to clunky answer to it, and I'll ask policy to help me on it. But I know eligibility updates are on that list for you. So I want to make sure we have time to have this conversation and the conversation about CFSS and PCA. And so they're kind of the next items in this agenda. So Amy, I'm going to start with eligibility update slides, and then I think there's a natural transition to have you come in and speak. If you would prefer to do this first slide as well, you're welcome to, because I know you and I have talked about how do we share the slide content. So
yeah, Teresa, if you don't mind, if you want to start with this slide on 39, since it's more kind of about assigning and things. Yeah, that you're a little more familiar with, and then I can jump in after that.
Yep, sounds great. Thank you. So part of what we're working on is we totally understand that you have assessments ready to go April, and that you will be doing them and moving into the new system. We know that there's going to be a period of time, whether it's a week or however long after that, where you're going to need to be doing assessments potentially in the old system because you won't be able to do them all in the new. But so that's a caveat, okay? So I'm not being insensitive when I give you this information, but we're trying to help figure out how to reduce that for you so that you're in the new system as soon as you can. These are two methods that I've been thinking about. By no means is this the end all be all, so please don't take this as we're not listening to you, because we are, which is why we're covering the eligibility update slides. So with that big disclaimer from Teresa, let's talk through these two. So the first one is April 3rd comes and you're like, oh man, we have all these assessments coming up, maybe not this first week, but in the next week after and the week after that, and we've got to figure out how to get that all resolved in the system. So one thing I'm hearing managed care doing is this first scenario. They're going to give their certified assessors their lists of people, and potentially in spreadsheets with assessment dates and what to do, and they are literally going to have them go in and search for their people and assign them to them. I know for some agencies that does not work, so I'm just telling you that is one solution that's being considered for a group of people. Another option you would have once you get kind of past those first assessments is to potentially do this. So instead, have a team of assigners search for people and assign to location for all of those people, whatever location it would need to go to, and then have people go in and bulk assign them. So for example, you could have the supervisor of a group of assessors go into bulk assignment and bulk assign to all of their staff. Okay. And then again, you could provide assessors a list of people and assessment dates as a potential workaround. These are not the end all be all. They probably aren't the only solution, but I just want you to be aware of these are two pieces you could consider. Okay. And again, it's not to be insensitive to the requests we've been given because we understand what you're facing. These are just two possibilities, no more, no less, in case people need some examples. So let's talk a little bit about eligibility update itself, okay? So you need an eligibility updated needed for the initial assessment. It's after July 30th or after June 30th. And you know, the system has been retired and you're trying to figure out, well, what does that look like? So for counties and tribal nations, you'll of course need to keep close track of days as you are heading towards June the 30th, 2023. And if at all possibility, you're going to try to complete that eligibility update before June 30th. If for some reason you're not able to do it and you need to create an eligibility update after June the 30th, then you'll need to create an initial assessment in the revised MnCHOICES application. And then in MMIS, you'll enter EU in the screening document so that it is clear that it's an eligibility update. And then from there, Amy, I will move forward with slides. Do you want to say anything more about this slide though?
Sure. Yeah, I think you hit it, Teresa. But yeah, so the issue with, you know, why we have to create an initial assessment in the revised MnCHOICES is you're not able to create an eligibility update if there isn't already an initial assessment in the revised MnCHOICES application. So to kind of work around that, you would just create it as an initial and document somewhere in there that it's actually the eligibility update. And then when you go and enter the screening document, you're entering it as an eligibility update to allow you that additional 60 days. So that's if you don't, like Teresa mentioned, that's if you don't get it entered in MNA prior to June 30th. And then you can move to the next slide, Teresa.
Yep.
So we had put together a couple timelines just to kind of show what this will look like. So as Teresa mentioned when she first started talking about this topic, you know, we do recognize that although, you know, ideally all new assessments will be done in the revised MnCHOICES application as of the day that it's available, April 3rd. We realize that that's not always going to be doable, that there's other things, you know, with assignment and everything that some assessments in those first week or first 2 weeks even, you know, may have to be done in the old system. As Teresa mentioned, you know, really prioritizing new assessments into the revision as of that day of launch is ideal because then, you know, you don't have to worry about these timelines for eligibility update. But so for this example that's showing right now, this would be if an initial assessment was done on April 7th. So that's, you know, 5 days or so after the launch, you're doing an initial assessment in MNA. And this just kind of maps out what those timelines would look like then for the EU. So the last day that you'd be able to open the eligibility update in MNA would be June 30th, that last day that it's available, and that's the 84th day. So you know, are still in that timeline, the 60th to 90th day. You are losing a few days because, you know, you technically have until day 90, but you're still able to open it in MNA on the 84th day, which buys you that additional 60 days. So that's the scenario if you were to do an initial on April 7th. And then you can go to the next one, Teresa, which shows another scenario. So this scenario would be April 17th. So this is 2 weeks after launch. 2 weeks after launch, you're still having, you know, doing an initial assessment in MNA, like what, as I mentioned, like you want to try to prioritize doing these in the new system, but just recognizing that that might not always happen. So this is 2 weeks after launch, you're doing an initial in MNA, and then this gives you your timeline. So the last day that MNA is available would be the 74th day. So you'd still be able to go into MNA if you wanted to avoid having to open that up and you knew the person's outstanding eligibility factors were kind of, you know, wrapping up or you knew that you'd have enough time. You could open it in MNA on that 74th day on June 30th. And that would avoid having to open an initial assessment within the revised application. If you don't want to open it that day, or the timeline you think is going to be tight and you want the full, 90 days, then you would do that procedure that Teresa mentioned where you're going into the revised application, before the 90th day, and you're opening it as an initial and then entering it as an eligibility update. So these timelines were just kind of developed to help show the tracking, that would have to take place if you're not doing initial assessments, as of day one, that you'll have to kind of keep a close eye on those, either open them in MNA, the last day that you can, or even a couple days before the last day, or if you're not able to do that, then you're doing the other procedure of opening an initial in the revised application. And then the 60 days after. So if, say, you open it up in MNA, I just saw a question in the chat, so I'm just addressing that. So you open it up in MNA, maybe the 29th or the 30th, one of the last days that it's available. That's going to buy you that additional 60 days. You don't have to go back into the application. You would just enter a screening document in MMIS when the person is ready to open, as long as it's within that 60 days. So that 60 days, that the eligibility update buys you, you won't have to go back into MNA. You won't be able to, but you will just enter the screening document then within that 60 days to open them up, sorry. Right, I don't see any other questions about eligibility updates, but I'm thinking there might be a few, so I'll give it some time, but I think those were the last. I think that was all we had for that, Teresa.
Yep, I actually wrote down that last one in case it's not in the transition instructions.
Sure, okay, yeah, and then there's another question that just came in too about how the support plan will be done in these eligibility update scenarios. So yeah, if you're kind of waiting until the very last day to open it and trying to get as much time as you can, then in that instance, the support plan would be opened in the revision because MNA won't be available or MNSP won't be available. You'll open the support plan in the revised MnCHOICES application as that transition reason that I think you reviewed earlier. Yep. So support planning would be done in the revised MnCHOICES application in that scenario. All right, Beth, I don't know if there's any other questions on the phone, but in the chat, I think that's all that I'm seeing right now.
I don't have any hands raised.
Okay.
Okay, I'm going to go ahead and go to the next piece. Oh, I see Ashley has her hand raised, so.
She does. Hang on, Amy. Ashley Gustafson, I have unmuted you.
I just had a quick question about the, when you were talking about the CSP for the eligibility update. So with the revision, my understanding is that the CSP is part of the assessment. It's kind of that final summary piece. It's not a separate document. And so if you do the eligibility update, let's say you do it on that last day in the old MNA, then and I understand that the case, like a CSSP or the case plan would be opened in the revision, but what about that CSP portion?
Yeah, that's a great question. Thank you for asking that because I wasn't clear when I answered the last question. So yeah, you would, in the scenario where you're opening the eligibility update, on one of the last days that MNA and MNSP are open, you would need to do the CSP for that eligibility update, within the system as well. So the day that you're opening it, you do your CSP. Typically I think for an eligibility update, you're, kind of updating the CSP, so you're not usually completing like a completely brand new, you're kind of saying that you're opening the eligibility update because there's external factors that you're still working on to determine eligibility. So, but yes, you're right, you'd have to do that in MNSP prior to the last date that it's being held up. So you would do your eligibility update and your CSP kind of together and get those done, and then the actual support planning would be done in the revision.
And Amy, so if indeed the system is retired and they need to do the CSP in the new system, that is done in the initial assessment in the assessment summary, correct? Am I thinking about that correctly?
Correct. So yeah, if they don't do the eligibility update in MNA, because the timeline didn't work out, or you're trying to get to the 90th day, or you just missed it, and then you're doing it in the revision, then yeah, then the CSP is wrapped into the assessment there. But I think her scenario was if you do it in the last day, you know, how do you do the CSP? And she's correct that you'd have to do that in MNSP as well. So, you know, ideally the same day that you're opening the eligibility update, you would update your CSP and get that done as well.
So they need to be mindful of that timing to do them
yeah.
the second to last day or the day, and they have to make sure they get them done both. Yep.
Yeah.
Thank you.
So it's, you know, they already obviously take some tracking of these timelines anyway when you're doing eligibility updates, but it'll just be a little bit more pressure on the timelines, you know, to try to get them done, so you don't have to create more work, you know, by entering an initial in the revision. But, you know, since we have the 90-day timeline, as long as you're trying to prioritize as many initials as you can on those first couple of weeks of launch, you know, hopefully the timelines will still allow you to do most of your eligibility updates in MNA. Yeah. Any other questions? You can put them in the chat, or if there's anybody else on the phone.
Do you have a couple folks on the phone if you're ready? Janet Bolander, I'm going to unmute you. Hi, Janet. Oh, muted again.
Okay.
Janet,
can you hear me
now?
Have
a question?
Yeah.
We can. Hi.
Hi, everybody. See, we have a question from MnCHOICES. Just going back to the legacy assessments, you had a slide that referred to LTCC, DD, and PCA legacy. And we just wanted some clarification on whether or not those documents are being retired June 30th. The reason I ask is MnCHOICES, along with our other larger metro area counties, we contract out for PCA reassessments.
Yep.
And maybe you're gonna get to this at a later point too. So I apologize if I'm a little premature with my question, but
no, it's an okay question, and I think it was in instructions, and maybe I missed putting it in. So you will continue to follow the plans that you have already built with DHS, and I know there'll be some further work on that. Beth, were you going to say something else?
It was me, actually, Teresa. This is Amy again. Yeah, I was just going to mention that, you know, yeah, we are aware that there are some agencies that are utilizing contracted agencies to complete those legacy PCA assessments, and that, you know, we'll be working with those specific agencies to develop a timeline for ending those contracts and transitioning that work to MnCHOICES. So yeah, that will be something that we'll be communicating with you about for those agencies that are utilizing contracted, but they will not be retiring as of the day of launch.
Right.
Okay.
Yeah, that's the piece I wanted to be clear about. We're talking about when forms will be retired, but it doesn't automatically happen at launch. And I think the original transition instructions were maybe a little nebulous about that. And so we've kind of removed the retiring forms conversation from the transition instructions until we kind of determine when that's going to occur, since we don't have dates in mind at this point. I'm not overstepping my conversation about that. Am I policy?
Nope, you're not. You're not. I mean, we still use those documents for other things. You use the DD screening document for OBRA. You know, so I mean, we've got other work to do post-launch to work on those documents to align them for you. So
thank you all. We just wanted some clarification on that, because I think all of our hearts stopped in MnCHOICES.
Yeah, you had heartburn.
No,
right? Thought of trying to do that.
Yeah.
Thank you.
No.
Sure.
Thank you. Okay, Jessica, I'm going to unmute you. Jessica Mickelson.
Yeah,
there you are.
Workflow question. Would it be acceptable for us to just take kind of a paper intake and hold off until 14 to 20 days prior to launch, and not put them in the old system, and then just enter everything for that person in revision, so we're not having to duplicate that entry when we know the assessment will be completed in revision, or will that throw off timelines?
I think the reality is that workflow process for your agency is your determination. And if that works for you so that you can be ready to go on launch date, I think again that that's your determination. We've kind of left that each agency kind of has its own process and way of doing things. And again, policy, would you add anything else to that?
Yeah, Teresa, this is Amy again. Sorry, I'll just add that, you know, there are a lot of fields that will migrate over. So if you want, and I think we'll be providing, I know Teresa reviewed it on the slides, but we'll be providing more of a document that explains what those fields are. Because there are a lot of fields that will migrate over that, you know, won't create duplicate data entry. So it's the narrative fields mostly in the intake section won't, and some of the other emergency contact information, but a lot of the person data fields will migrate over. So
you might want to, yep.
Yeah, you might want to. So we'll, you know, like I said, we have a document that might be helpful. Teresa and I will work on getting up that to you guys as soon as possible, so you can kind of make that determination for each of your agencies to say, you know, should we wait or should we just get at least this information entered that we know will migrate over?
Yeah, and that's why you heard me earlier say we were really kind of, our light bulbs were going off about really what the question was you were asking. And so we started to ask the deeper questions about what data would come from that area to the application.
Okay, sounds good. Thank you.
Yeah, you're welcome.
And Jennifer has an enhancement request that she has in the chat, and I just want to let her know that we will record that. Thank you. Okay, Teresa, should we keep going?
Yep, we sure can. So this is another one of those ones we know we all need to talk about. We need to talk about CFSS and PCA in the revised MnCHOICES application. Beth, I'm sorry, I'm just going to go there and quick look at my slides ahead of time. I think I'll take these first two slides, and then if you and I want to work together on the others, that would be my preference, if that works for you.
That works for me, thanks.
Okay. So one of the pieces that I did this is the CFSS to PCA conversion worksheet that policy has built into the application, because you all are aware that MnCHOICES, the revised MnCHOICES application is set to do eligibility for CFSS. So you will need a way to convert your information to PCA. So let's talk a little bit about it. So one of the things that we did in the training is to make sure that this conversation is included in training modules as well, so that you're aware of it. And so basically what will happen is you're in the new form category, you've created your assessment, and you need to do the conversion. You've run the results and you need to do the conversion. So what will happen is you'll pick the category assessment and you'll see the form CFSS to PCA conversion worksheet. And so that when you select that, then the form will be available. You do need to know, though, that currently it isn't available in MTZ. Beth is working very hard to fix that issue so that it can be. So please don't be concerned about that. It is something that we are working on so that you can look at it and use it. And Beth, do you want to talk a little bit about what this worksheet does and based on the content on this slide?
Sure. Yeah. So until CFSS is implemented, we need to convert the CFS hours to PCA. And basically what that means for CFSS, there's no more LT. So the LT is going to be gone, and there's lots more training that's going to go into much more depth than that. But my purpose here today is just to kind of give you an overview of the worksheet and really what you'll need to do for the worksheet. And so after Teresa showed you the beginning of how you access the worksheet, you go in via assessment, the form type, and then it's the CFSS worksheet. Then you'll come to the worksheet and it'll ask you to enter in 3 things. So you'll enter in the assessment ID, and then you only have to do this worksheet should the person have a home care rating of PQ or R. So what we're trying to do is double check PQ or R to see if they need to revert back to LT or if they can remain PQ or R. And so you're going to go through after the first question of assessment ID, it's going to ask you 2 more questions, and it's going to want you to input the level, the home care rating that MnCHOICES produced. So if MnCHOICES produced a P, and then it'll ask you to indicate the number of ADLs. Is the next question. And with that calculation, so you're going to say 0, 1, or 2 to 3. And depending upon what your answer is to those questions, the next section will show you if the person is still LT and the number of PCA hours and units that they get based upon that new home care rating or that old home care rating. And so, and then in the next box, it'll give you instruction to update your assessment summary. It gives you the actual verbiage, and then you print this form, you attach it to the CSP, which we're calling the assessment summary, and you update the assessment summary with that information, and that is it for the form. So it's rather fast to go through and do. It does all the calculations for you. And it gives you the results. We don't have it yet in MTZ, and we're working on trying to get it in MTZ. Right now we have a transfer issue of how to transfer it, but we do have it in our higher environments, or the other environments, the UAT environments, sorry. And we are, and it's working and in both of those environments. So for more information, we'd like you to go to the TrainLink MnCHOICES workflow. Assessment results and assessment summary module 7 to just give you more detail than what I just provided. But it's pretty straightforward. It shouldn't take you very long to do. It just should be a matter of minutes. It's 3 fields. And there's information that's pulled in about the person, like their name and the assessor name. So any questions? Oh, you have some questions. Can you just use the CFS hours as PCA hours for now? So currently MnCHOICES, the MNA, is calculating PC hours correctly. It's calculating with LT. It doesn't have the changes for there. No, you couldn't just use the CFSS hours. You need to, if the home care rating is not P, Q, or R. If it's a higher home care rating, then this is not for you. You don't need it. You only need it if the person has a home care rating of P, Q, or R. And then you just need to insert it into the worksheet. And it's a communication to the person too. You'll see when you print it, out that it's that all the assessor instructions go away, and you are able to see just to provide a quick thing for the person saying, hey, this system was devised when we were planning for CFSS. CFSS has not launched. Then we're planning for PCA, and so this is what your home care rating is. And so we say it there.
So I just logged into UAT, just so you know. Okay. And then, so right, you can see just the 3 to make the conversion. You can't use this CFSS hours because if the person may not be CFSS hours. Sorry, I'm trying to answer. The CFSS hours might be higher than, so if you're getting a P and you're supposed to be LT, so LT is 2 units, right? 2 units of PCA, where P is higher than that. And so it doesn't convert back. So we need to convert that P back to an LT to the lower amount of hours. So I think P goes up to 5 units. And again, the purpose of the form is to just take some of that having to translate out of you having to do, and having the form do it for you. Right, and knowing that it's just a really quick change. Right. So all you have to do is you don't have to understand the policy. You just have to pick the numbers, and then it will tell you. Correct. It will show you all that you need. It'll give you the details of what you need in here. And how are we going to create a service agreement for people with a higher home care rating? So you'll still get higher home care ratings, and you'll create your service agreement as you normally do with those. All this is trying to do, because right now MMIS isn't going to let you enter in, when you're entering in the type B service authorization, it's going to stop you from entering it and saying, hey, wait, there's an issue because this person is really LT, they're not P. And so that's the conversion that you need to make. So what you're saying is the rest of the results are correct. They don't need to be translated back to PCA.
Right, right. Anything above S and S to Z or EN, you guys are fine. There's none of that needs to be translated. It's just these three values, a P, Q, or an R. Samuel, you're asking about the CFSS launch, and we know the same thing that you know at this point, that it won't be before April 1st, and more will be coming on their launch date. We're hoping that this will be a shorter workaround for you, or a shorter time period where you need to use it, but we don't know. So there's a lot of factors that matter, or that are dependent.
And part of what we were trying to do is come up with absolutely easy solutions for you to use to make this transition more smooth. And so this document is there to do that.
Right. Well, you're going to attach this to your assessment results. If someone were to appeal, sorry, Melissa, you asked a question regarding, will judges be aware that our assessment will say one thing and that there will be a conversion sheet that will trump assessment results? And this is why you would include this in your response back to an appeal in this situation.
And so you can see here that you can save the entire form, and then you can attach it to a person's record.
Correct. We have one call that's somebody on the line. Shelly, I'm going to unmute you. Hi, Shelly.
I just want to make sure I'm understanding this correctly. So when you were talking about MMIS won't allow a type B service agreement to be entered, is that if there's a value of P, Q, and R? And that's when you need to come in and do the CFFS or CFSS to PCA conversion? Is that how I understand it?
Right, because if you enter in, well, it's not going to give you a home care rating of that either.
Okay.
So it really is, if you just have a PQ or R, come do this worksheet, and then it just streamlines your flow into MMIS for your type B service authorization.
Okay. All right. I just wanted to clarify. Thank you so much.
Thank you. Angela Daspo, hi.
Hi. So this worksheet, is it going to give us the type B service agreement? Like once
No.
So how do we get all those codes? Because when you get that document now, there's a ton of codes that have to be inputted into MMIS that is currently being done in MnCHOICES for us. But this new system is not set up for PCA. So exactly how do we do that with this conversion stuff?
It is set up, but we had to do it a little differently. And so when you are, if you're doing, so you do your assessment, summary, you do the conversion sheet that all ties the assessment together. And then for the support plan, you actually get the type B support plan when you select CFSS. You get the type B service agreement, in the support plan. So when you select CFSS as your program type, you'll go in and you move assessment content over. So you make it an assessment or the support plan with a status of in progress, assessment complete. And then you can print a type B service authorization from there. And when you do that, you can look to see that all of the assessment values, all the things that were recorded in assessment regarding tube feeding or just all those variables on a type B service authorization are included, but you get them from the support plan because the type B is, it's kind of a combination of assessment results and support planning, right? So you have that, or in a service authorization, you're entering in services all in one. And so it needed to be, for our purposes, it needed to be in the support plan. So it's a little different than what you've seen in our current system, but it's there.
So if we're choosing CFSS as the service in order to get the type B, are we going to get the correct
program?
rates?
Yes. You will, because it'll say CFSS, because you're not choosing CFSS as a service, you're choosing PCA as a service for your actual service, but the program type. So you're required when you're creating a support plan to create a program type. And so when you choose, so what I'm saying, and when you choose CFSS, it says CFSS/PCA as your program type, that's what's going to make the type B work for you.
Yeah, and
because
so
it's the only time that you'd use a type B.
So I'm going to leave you two on the line for a second to just say this. The other piece that has been built into the support plan for services are both PCA services and CFSS, knowing this transition is going to occur. So when you get to the support plan side, you'll choose PCA services and PCA providers while PCA is available. When CFSS comes available, right, when it launches, then you will go to the same place and you will choose CFSS services. So they are both there and available to make the transition as smooth as possible. Okay, so then that conversion form will retire, and so we'll be ready for both. So you won't have to kind of do guesswork or try to figure it out. It will allow for planning for both on the support plan side so that the service agreement detail is correct. And that is what I hear your concern being.
I just wanted to know how it worked because it was my understanding that PCA wasn't even in the new system. So, you know, when we talk about when we talk about converting on this worksheet, you know, I was just thinking, well, you know, everything, all the other steps that follow, how is that going to work? Yep. And so yeah, as long as PCA is there and we can choose it, then it'll work.
Yep. Yeah, hopefully. And I actually wrote notes about this conversation just to make sure that we're clear about how we talk about it all the way through for training, to make sure that people really understand both are available. You can go from the assessment side with the conversion to the support planning side, because yep, I hear that you need to know the workflow all the way through.
Okay.
And also know that just because CFSS is launching doesn't mean PCA is going to go away. There's going to be a period of time that both will be in play. So just know that that is available to even people that are continuing. If you just started your assessment, your renewal, you're on PCA and don't want to change, and didn't choose CFSS, you might still have another year of PCA. So they're going to live together for a little while.
Okay. Thank you.
Thank you. We will have a workaround for CSG. Right now, it was just choosing. I see, Shelley, you're asking a question about that the system doesn't allow CSG as a choice, and we will have a workaround for you for CSG for when PCA launches, until CFSS launches and CSG goes away. There is training. Okay, I can respond. If you had a question about training, there is training online about CFSS. So if you guys are interested in learning more about the program and what's going to happen with it, there is training online that you can take in modules, short modules, that would provide some more detail. So know that that's there too. It's on TrainLink. Thanks, Teresa.
Yeah, so as you can see from this slide, right, then here's the course content, here's the course modules that are available. And I'm realizing I'm talking on mute, and so that's hysterically funny, but yeah, so this is available. And so it comes after. So I'm like, oh, you guys didn't hear what I said. So that's what we're going to talk about here. So that you are aware. Are there any other questions about CFSS that need to be talked through any more questions. Otherwise, I will move on to next content because we only have 8 minutes left. I got to see how many slides I got left. Oh, we just have one more slide after this, so we are in fine shape if we need to take other questions. You know what I think I'll do is I'm going to do the last slide. Then if there are other questions, then we'll have time to get as many as we can done till noon. Thank you everybody for your patience. We are trying to cover this stuff that we know the details that you need to understand to do the work that you need to do, which is why we wanted to have the county and tribal nation conversation separately from the MCO one to make sure you got the time to ask your very specific questions. So thank you for asking them. So one of the questions that we've been asking is about getting a crosswalk from the MnCHOICES assessment to the revised MnCHOICES application. So specifically for the assessment. And here's what we can tell you. The assessment content, though it's similar, there really isn't, and you heard Amy say this earlier, a direct, this one goes to that one, this one goes to that one. Because the items were revised to provide clarity for the assessors and the response options were adjusted to provide some consistency, where before in the current MnCHOICES application, you sometimes have questions about those responses. The work was to make some changes to them. So it's because of those adjustments, we can't do a crosswalk link from one to the other. But post-launch, we will provide in the revised MnCHOICES application selections and eligibility crosswalk for the screening documents. So that will be coming as a crosswalk for you. And so we just wanted you aware, since we know this is a question that you're asking. And my next slide is a question and then a slide, and then we will be at the end of the webinar. So we are happy as a group to take other questions from you. Do you have other questions? You may raise your hand, put them in chat. We prefer raised hand because then we get to get a little bit deeper in the conversation.
We have a question from Betsy Farley. Betsy, you're unmuted.
Okay, sorry. Thank you. The question I had was in regards to, for example, the workaround for the one we were just talking about. Part of the instructions say to attach the worksheet to the assessment if indeed you have one of those home care ratings. And then my question is, and it might be ignorance on my part because I haven't finished all the training yet, but as far as the assessment summary goes, when we are making like corrections, or are we able to with our, type in any kind of overrides or corrections right onto the assessment summary?
There are statuses that you could move the assessment into. So there are statuses that would allow you to reopen. We are working on, oh gosh, Amy, I'm not sure about the reopening of how to reopen those. I'm trying to make sure that you're able to do that at a lead agency level, but we're still working through those details.
There is current functionality for a lead agency supervisor to reopen an assessment.
Okay, maybe my question is more around, if we're getting our results on the assessment summary that really aren't quite right because of just different issues, and so the assessment summary that we're sending out to the person needs to be kind of hand corrected somehow. Can it be hand corrected digitally by the assessor within the tool? Is there a way to update fields, so to speak, in that assessment summary?
That's what we're saying. If it's closed, okay, a supervisor would be able to reopen it, so you could make those tweaks that you need to make to the assessment summary, because it's part of the assessment now. So it's not like its own living thing. It's within the assessment. So you'd be able to reopen the assessment, make those tweaks, and then reclose your assessment. for the assessment summary.
So the point, so you wouldn't have to basically quote unquote hand correct, right? Whatever that looks like digitally or in writing on the form.
So you would be able to go back into wherever it is that data lives and correct it in there so that the assessment summary comes out the way it should. Is that what you're saying?
So this is Amy. I'll jump in.
Sorry.
I think you're asking maybe something a little different. So there are some areas like, as we're mentioning CFSS or case mix, or there are areas that will require some hand correction that I think Teresa will be reviewing at a different webinar, some of the current functionality and some of the workarounds to make it work. And so there are going to be some areas that will require some hand correction. And so I think your question is that able, can you do that electronically, or do you have to like print it and hand correct it?
Yeah, that's kind of what my question was. Sorry. Yeah.
So yeah, there is the ability to, so you can save it as a PDF. And when Teresa reviews the current functionality doc, there's some instructions on how to do that. And really what the instruction is just to make sure that you can tell a correction has been made. So you can do it electronically, but you have to be able to, like, you know, somebody else who looks at it has to be able to distinguish that it was a correction made and that it wasn't populated by the system, if that makes sense. But yes, there is capability. You can save it, you know, you can save it as a PDF and you can edit it that way. I think you can also save it as a Word document. So there is some ability to do that. It's just making sure that the hand corrections you're making, you know, are evident that you've made that correction and it wasn't provided by the system. But as I said, that's all going to be included in that current functionality document that Teresa will be reviewing, I think, Teresa, at a later webinar.
Okay, that makes sense. Thank you.
And Teresa, you can correct me if I'm wrong on the review of that document as well.
So just so folks know, we are talking about having MnCHOICES mentor meeting where we're going to review all of the current functionality, issues and workarounds in 3 hours. You got an email on, I think, Friday of last week with a survey on the 3 possible dates. And if you haven't had a chance to do it yet, please go and take it. I'm going to see if I can find the survey link and put it in the chat. Or, you know what? I'll probably have to send it to someone because I can't see the chat when I'm presenting. But we could put the survey there. We've chosen a January date, a February date, or a March date. And we will pick the one that has the largest amounts of votes, knowing that we'll record it and make it available for the archive. The reason why I'm calling it a MnCHOICES mentor meeting for people who are new to that process is because we teach mentors what the issues are and what the workarounds are, so they're comfortable supporting staff going into the launch of the revised MnCHOICES application. We heard you say that you would really like the opportunity to have a deeper dive in that, and so we're making sure that we honor that request from you. So are there other questions? I'm going to the doc that I put that link in, and I'm going to try to put it in chat to one of you guys on our side so you can put it in the Q&A. I'm seeing we're at noon too, so people are aware. I haven't lost audio feed, right? You guys can hear me and I can hear you.
No, you're still here. Sorry. So just, I think maybe a last question is there, do we have a good example for folks to look at to see in the revised application where they can see attachments? And well, I'm not sure what can request data copy means, but because you copy from plan to plan in there, but if there's a person that we have that would have attachments so they could see what attachments look like.
think I have one. I don't know that it's the most illustrious. Oh, I'm in UAT. I don't know that I have one in there, but I mean, I suppose I could make up an attachment and we could attach it. I have to see if I have anybody with an attachment. Yeah, so this one I just created a sample attachment, gave it that name, and I can go in and view at it, and it probably is some picture of something. But you can, when you're in MTZ, practice adding attachments. You know, practice, so see it just a sample attachment. But you're welcome to go in and you'll not want to create anything that is real data, right? But you could take a screenshot of something on the application, name it something, and then attach it so you can see how it works. You can practice viewing it and downloading it. So you're welcome to do that to get a sense of how that works. That's what MTZ is for.
Teresa, I think we have 3 quick questions.
Okay.
Okay. Madonna and Melanie. I'm sorry, Melanie. Here's Melanie Courier.
Classes. Zoe. What's she doing today?
Melanie, we have you unmuted.
I like them so far.
Okay. I will go to Ruth Rowenhost. Okay, Ruth, you're unmuted.
Can you hear me?
Yes.
Okay. So one of the questions that we have, I've got several, is with creating the support plan, we'd like the narrative doesn't transfer over into the support plan, right? So one of the things that we can do is print the supplementary summary charts, and that has the narrative in it for non-MCO. When you sign in as a non-MCO, that is not available for the MCOs, correct? I don't see that as.
So say more, it is available. I mean, the MCOs can see everything in the system, but say more about why you'd want to print that. Who are you printing it for?
For the case managers who need to copy paste any of our narrative from the assessment into their support plan.
So, you know,
Well, those
they
case
can
managers are going to have, oh,
yeah,
sorry,
they're
go
gonna
ahead.
have access. They're gonna have access to the support plan. They have view capability as part of that, and so they can go to view the support plan, and I believe use the print drop-down menu and review the narratives. I was gonna.
Right.
So.
Oh, but that narrative isn't available that I see in that same category. Supplemental summary charts is the narrative in the non-MCO. But if I'm signing it under, say, my Medica, that is not an option in the drop-down box for print.
So I hear you. So in the print options, if it's a support plan, MCO, MnCHOICES assessment, are you speaking to?
Right. Well, any of the narrative part that, you know, if you're talking, since none of it transfers over to the support plan and a lot of it is the same information, what do you want to know about me and all that kind of stuff you want to put into the support plan. So you have to copy paste it.
Yep. So your point, what you're saying is if that's a support plan other that in the print, you can't see the supplemental in the drop-down menu. That's to your point.
I guess I can't see it in the MCO drop-down menu. I can see it in
so
the.
this is a support plan
when
for.
as an MCO.
Yeah. So let us look. Yeah. Let us look at it.
Yeah.
Yep.
So.
Okay.
Go ahead.
No, that's okay. That's okay. Sorry, finish your question.
How are we supposed to view it to copy and paste that information over? I think one of the options might be split screen so you can see it as well. The problem with the split view is that the right-hand side, you can't scroll down, so you can't.
Yep, I know. Yep, it's in the current functionality document, but yes, you are right, that would be. So let us take it back and look at it, and then we can talk about it later. But I'm hearing you already solutioning, which you need to know we really appreciate. So
okay, we're trying our best. It's really, we really want to understand it before our other people are training on it and
Yep.
It's hard.
Yep.
One
Nope,
of the other
understood.
questions I have, and maybe it's answered somewhere, but on some of the questions in the assessment, there's that yellow sidebar
Yep.
mark. What is that?
So, okay, so you need to think about each of the required fields differently. If it's got an asterisk, you know it's required to complete the application, right? And it's going to show up in the completion requirements. The yellow bar is to remind you that it's a field that is required, but you can come back to it. So it's not going to stop you from doing your work as you're working your way through it, but at some point you need to come back and do it. It will stay yellow even after you've done it. Again, just as a reminder, okay?
Okay.
Sometimes, because I heard the question asked about kind of required fields, sometimes when you go into these, like you add something, and then you're like, oh, this is a required field. How come I have to fill it out? It's requiring it because you've chosen to go into that window. If you weren't in that window, it wouldn't be a requirement. And so sometimes people get confused by that functionality because they see it as required when they open the window up.
Okay, great. Another question. In the support plan on the rates, we're not able to close the support plan because the frequency isn't saving on the rates. Are you aware?
Are you using only the services that we've suggested you practice with?
We're doing it for customized living with a provider that has that ability to
I know,
provide.
but the reason why I'm asking you that question, I'm sorry, I just want to make sure that I share this, is in the training we give you a specific services and so specific service provider and HCPC to practice with, because the services in MTZ aren't all the way built out like other systems. So I get it, right? You're practicing with other services and building it out like you'd used to. But we can't guarantee that those services don't have defects with them, which is why we give you a very specific group of HCPCs to use. So
Can
I
you
was
remind
asking you the question because if that HCPC isn't working, I need to know it, because then we need to either fix it or give you a different choice to practice with.
Okay, and can you remind us then, please, what those HCPCs are so that we can do that?
If you go to the training that is the workflow for support plan, that's the My Supports, and go to the exercise, like if you just open up the training and go down the side menu and find the exercise, it will give you it.
Okay.
So
great. Okay. Will you also, and maybe this will be in that 3-hour training, tell us what the difference between the MTZ is going to be versus production? Because I know there's going to be some differences, but it would be helpful to know ahead of time. We're training in the MTZ and this might not work this way in production. Are we going to have those?
So quickly, and then we need to be done with time because we're already at 10 minutes over. But where MTZ differs in functionality is oftentimes about what's happening in the background, so specifically around services and service providers, more than about and how many things you can practice with and do. But I hear your question about level of confidence, knowing how it's gonna, if you have to learn something new when you come to production.
Right.
And so I will take that into consideration and look at, is there a way to talk about it?
Thank you.
Yep. And then besides that, folks, I think we have to be done because we've let it go 10 minutes over. I'm assuming some of you need to get off of the call, as well as I'm assuming some of my folks here would like to go on to other meetings as well. And I just need to be respectful of everyone's time. Amy, I don't know if you had a chance to put I sent you the survey in your email, and if you wanted to, you could put it in the chat. So if people want to vote on when to do the mentor meeting around current functionality, they still could, because that survey will close on Friday. So I want to make sure we leave the call open up long enough so people can grab that if they want to.
Yep, I did add it into the chat. It's at 12:06. So there should be, if everyone looks in the chat, there should be the link that you can click on to get to that survey.
Yep, so if you can, please go ahead and click on it so that you have the link available to you, because I think once we close WebEx down, then you won't be able to see the chat. So I'm just giving you a second or two to go ahead and do that, please, to locate it. I'm assuming it's at the bottom of the chat. And then I think we need to go ahead and close today's conversation because we're over time, but we know that your questions are important and you're trying to get your head around workflow and how to use the system. And we really want to make sure we have a chance to have conversations. So thank you everybody for today. Thank you for your patience. Thank you for your really good questions. I've been keeping track of the places where do we need to provide a little more clarity or not. And we'll have some more conversation about this between us later yet today while it's still fresh in our minds. So again, thanks everyone very much for attending. We're going to close today's session and we're going to let you go do other things and we'll go on with our work as well. So again, thanks. We really do appreciate these conversations. So thank you very much.